Welcome everyone, Dr. Naveen here from UPSC MEDICO. A special message to all the UPSC MEDICO test series subscribers who are actually targeting 2024 mains. So I think you're busy with your general study revision now because the coming Friday to Sunday you have general study exam, and after that you do have a break, right, for 1 week. Then you will be writing your um, mains optional medical science on 29th September 2024. Now, I would like to tell you a few important things here. First and foremost, we have evaluated over 400 plus papers so far in the last 1.5 month. Right, 1.5 to 2 months. You have like the post prelims. There was some uh, like slow submission rate, but it has picked up in the last 1.5 month, and we have received good number of papers. This is I'm talking about the new test series which have introduced post prelims. Before that, there are aspirants who have practiced with old test series with different pattern, and also there are aspirants who are part of two batches of daily answer writing program. So overall, I am expecting around 110 plus aspirants from UPSC Medico who are giving their medical science exam this time. And this new test series, we already have 75 plus aspirants who have submitted papers. So this is the label of new test series, and you could see there are around 379 emails. There are some students who submitted multiple papers within a single email. So overall 400 plus papers we have looked into, and among them we have finished all the subject wise tests so far till date, and also we have finished sectional tests. Few tests are pending which will be finished in due course, and we are starting with full length test evaluation. I think there are around 45 plus papers of full length test which we'll try to finish by Monday. Okay, by Monday, that is by the time you finish your GS and come back for medical science optional revision, you will be having your full length test scores also if you have submitted them. Now, these are the list of the students, like around 75 students. We have evaluated that subject wise and set tests, and you could see like overall view that many of the students were able to submit more than 50% of the test series papers this time. So I think this could be because of giving you shorter tests so that you could have good exposure to all the subjects, and also for better answer writing practice we did try a different new pattern of test series this time. Okay, so these are all the marks of these students. I have also submitted the we have also uploaded the top 3 subject wise test copies so that you can take reference from each subject. You could see almost all the subjects we are done with the top 3, and we have uploaded them in the website. From your test series curriculum you can download them and see how toppers are approaching this. Okay, these toppers could be our future all India rankers, so you will definitely have a fair idea about how they approach and what is the best approach to get good marks in the exam. On top of that, we were able to upload successfully 28 hours of video discussion of these tests of subject wise tests, because sometimes what happens, unless I teach you what should be the differential diagnosis, what should be the approach, or what keywords we are expecting in the answer, you will not understand fully the analysis part of our papers, right, the evaluation part. So that's why all the subject discussion videos are live. If you want to quickly revise through the question paper and struggling to do it through the model answer which we provide, just watch these videos in 2x speed so that a quick revision of the test series can be done. Right, so we have done the evaluation part, the discussion video part, and we have uploaded the top 3 copies for your reference. Now let's see what are the common mistakes I have come across in these papers, so that when you're doing your last set of practice or revision, you have to keep all these things or all these points in mind. First and foremost, better time management. I could say not many students were able to finish exam in less than 1 hour. That could be because this is a mini test, or maybe in the final exam, because you get 3 hours of time, you will be able to do better time management there. Because when I spoke to most of the toppers last year, none of them had issue with the time, because 3 hours is a good time. You can kind of adjust time, and you can kind of approach exam in a time paced fashion. Okay, so first and foremost, always focus on time management and also space management. I told you n number of times, if the question is for 5 marks, you have to you will get one side of a page, and also many of the students are not respecting the borders. You have to use UPSC prescribed answer sheets or blank answer sheets provided with us. Why blank answer sheets provided with UPSC Medico? Because sometimes if you look at question paper and start answer writing in the answer, you might not know the sub parts of the question, and there are some students who are missing answering some of the sub parts of the question because the question is not printed on the paper, right? It is very important to practice in the prescribed fashion. Always advisable to use our own blank answer sheets which comes with the test series. So better time management and space management are essential to score well. Space management in the sense, if the question is for 5 marks, I could see students only filling 1/4 of a page. Okay, you have to elaborate, you have to give little bit of introduction and conclusion, you have to write some current affair related stuff so that the paper is full, right? That is very important. You go and see all India ranker copies, no matter whatever is the question is, they have enough content to fill one side of a page in stipulated amount of time. So time management and space management are key for any answer writing exam. And also in the medical science question paper itself, it was clearly mentioned to draw images, right? And UPSC board has instructed to use color pencils and draw images wherever necessary, right? So it is very important for you to draw images, and almost 70% of the students I could see them either not drawing images at all, or the images are of poor quality. We are not expecting you to be an artist, right? But at least a basic image, understandable image with proper title, proper labeling and color coding. Okay, use color pencils, give proper color coding, and make sure that your image is given top priority over the text. Okay, first comes image, next comes a flowchart or a table or a smart art with regards to PSM answers. PSM answers require smart arts. Like if you're writing about some NT, National TB Elimination Program, you have to give some objectives, targets, way forward. You have to approach answer in a smarter fashion with smart arts. You cannot just give the same very old content there, right? So don't use text or paragraphs there. Okay, so images more than flowcharts, more than the text or paragraphs. Okay, very important. And also presentation, the same thing which I'm talking about. Many of the students have poor presentation skills, and UPSC is always about art of answer writing, and presentation is the pillar of that. Okay, work on better presentation, give proper heading. Okay, proper heading, understand the demand of the question and answer accordingly, and to give a proper introduction, use current statistics or current data. Avoid, I could see, like if you're starting 1A answer, here itself you're writing some spelling mistake, or writing or overwriting or crossing it, that gives very bad impact on the examiner, and that there will be a bias that will be carried. Even if you give good answers in the last part of your exam, because there was that error bias in the examiner mind, you might not get good score. So make sure first impression is the best impression. Avoid overwriting, avoid spelling mistakes. And also if a paper is left out blank, and if you are not like some students, they start question number 3, after writing some answer they think that the question number 3 is not their cup of tea, they just go to question number 4, and sometimes they forget to strike off this question. It's very important that you have to strike off unanswered or left out question or blank answer sheet, so that the examiner is not confused in the final exam. Okay, so that was mentioned as a part of instructions in your answer sheet, right? So strictly follow the instructions which are given. And very importantly, some people use substandard abbreviations. They are writing like, let's say, C by F, D by D. Okay, see, RX is a standard abbreviation given by the medical board, but clinical features, differential, there are no abbreviations like this, so don't use them. Don't use up arrow or down arrow, sometimes they're confusing. Write increase or decrease. Okay, I might be using them for video discussion to save time, but you cannot copy that and put it in the exam. Never use any full form or an abbreviation which is substandard or not medically approved. Okay, please don't do that mistake. Only and only medically approved standard abbreviations you have to mention. You can mention TOF because most of the standard books they mention TOF as tetralogy of Fallot. Okay, but you can't mention EA because Epstein anomaly is never called EA. That will cause confusion. So you need to know whether abbreviation which is mentioned is standard. So it's better not to use abbreviations at all in the paper. Okay, even though it is standard, if you have a confusion, don't go for shortcuts in the exam. So never use substandard abbreviations. So lack of flowcharts and algorithmic approach. See, when I want you to investigate, like let's say example of hematuria, don't write 1, 2, 3, 4. Start with a case of hematuria. First, what we do, we go for complete urine examination, then we go for the other parameters like an ultrasound or something else. Give a flowchart based thing. And also for treatment, don't start writing treatment 1, 2, 3 unless there are some questions which will ask you, mention point wise management, okay, or point wise approach or point wise treatment, or highlight key points in the management. When they say that point, use points. Otherwise, discuss management means always and always discuss management in a flowchart fashion. When I say management, students are getting confused between treatment versus management. See, management includes investigations. Treatment also, if required, while you're treating a patient, if you want to assess the severity of a patient, you need to investigate. So, investigations should always be a part of treatment versus management, but it's a case based scenario. There are some clinical things which only require physical examination, which gives you a conclusion. You don't have to investigate, you don't need to know the severity. So in that sense, check whether investigations are required for this patient or not. If they are required, include them as a part of management and treatment. If you have any confusion or doubt, put investigations wherever treatment or management is asked, to be on the safer side. Okay, because see, it requires some common sense and also clinical practice to know whether to write or not. So just for the sake of avoiding a bias or an error, let's do a standard thing that I am going to write investigations for any treatment question or any management question, though it is not asked, just to be on the safer side. And also, many of the students, they lack differential diagnosis discussion. Diagnosis means sometimes they ask you complete diagnosis for 2 marks. So next time they'll ask you what is the provisional or probable diagnosis justify for 3 marks, or they'll ask you differential diagnosis discuss. When they ask you differential diagnosis and if weightage is more than 3 marks, give some positive and negative points about, like if you're talking about SOB, if you're talking about MI, because pain is not central, there is no Levine sign, there is no radiation, though it couldn't be an MI or an aortic dissection. You have to just conclude. So for the common DD, mention characteristics of that particular clinical feature within the DD. Okay, so answer as per weightage with regards to poor. I could see a lot of students has poor differential diagnosis discussion. This could be because of lack of case presentation. When you go to your internship during your during your final year exam, the practicals, when you present case, most of the times you will be drilled by an examiner in case presentation of symptoms itself. He will ask you, why not this? You have to tell the diagnosis is not X because this feature is not present. So you have to highlight those points of the weightage is for more than 3 marks or 5 marks. I had seen topper copies, even if it is for 2 to 3 marks, they are writing some features to impress the examiner. If you have enough time, never miss out on DD. This is where you can show examiner or you can show up, right? Now, clinical features, many of the students are struggling. Clinical features include symptoms and signs. You're only writing symptoms. You're ignoring clinical signs which we elicit. Symptoms is the one which patient tells. Signs are the ones which a doctor elicits. Okay, these are basics of our case presentation. You might have forgot it because you are into UPSC preparation, you're not practicing, but the one who is evaluating your paper is a practicing physician, so they will be looking at the signs. So never miss out on the science part. And also management versus treatment, as I already told you, there is always little bit of difference. They will say investigate this case and what is the treatment. If they don't give investigations directly, they'll say how do you manage. Okay, irrespective of whether it is a treatment or a management, UPSC MEDICO student will be writing investigations for all the treatment related questions depending upon the weightage. If weightage is for 10 marks, elaborate. If weightage is only for 5 marks of treatment, just give an introduction that general investigations, special investigations, investigations to know the severity. Right, now answer always as per demand, because in the question if they say enlist, just list them down. But if the weightage is for 5 marks, just listing down will not give you more than 2.5 marks. Write an important feature of each. If they say tablet, draw a table. If they say draw an image. If they say discuss in detail. If they say differentiate, put a table and differentiate x plus y. If they say critically analyze, you have to give current affair related points which comes in PSM part or social pediatrics and social obstetrics. And also if they say impact, what impact it is on. So always answer as per demand of the question. Don't deviate from the demand of the question. I could say some of the students even giving content which is not relevant to the question just to fill up the paper. Don't do that mistake. Always stay relevant, always always answer as per the demand of the question, and try to highlight the keywords. When I say highlight the keywords, some students are highlighting the whole paper like this, underlining. It looks very bad to the eye. Don't underline everything. Only highlight 4 or 5 key words in the answer by underlying or by using capitals or using it as a headings, or separately put a table and say, so 1, 2, 3, the key points in this answer are. So you can even do that if time permits, just to impress the examiner. That half mark, 1 mark extra for each answer will put you in top list, right? So don't commit these mistakes. And always see, you're a doctor and you don't need to show it to the examiner by writing prescriptions, right? I could say a lot of students just they start let's say analysis, this with analysis, then they'll put like this. Okay, if you highlight, then they'll just do like this. Don't do this prescription answer writing in the mains. Okay, finish off the words, finish off the sentence. Don't commit spelling mistakes or don't do overwriting. Okay, and never ever miss out on a PYQ. I have asked a lot of 2023 questions in the subject wise test, and students are struggling to write them. See, they might not repeat the same question, but topic will get repeated, and this knowledge will help you. When an examiner frames a question, he will look at the immediate paper and he'll try to ask the similar question in a different fashion by asking same or a different topic. This knowledge will definitely help you. So never miss out on previous year questions. So these are the 15 common mistakes that you people are committing. Just correct them before the final go, because not too much of time is left. If you're watching this video, I personally believe that I have added few more important tools to your answer writing by discussion of common mistakes. Do watch the discussion videos if time permits, and also do go through the topper copy so that you'll get an enough idea. And you are not alone, 75 plus students, and if you include DWP and old, there are around 120 students from medical science who are your competitors from UPSC MEDICO. I don't know how many are out of UPSC MEDICO. So definitely there is a good level of competition. You cannot relax, you have to give your best. And this year we tried hard to give you the best content, best discussion videos. And also evaluation, sometimes it got delayed because of the caseload, the paper submission load, but definitely we were able to give maximum number of papers on time. So our team needs your support by just a positive review on the website, because nowadays if a new student comes, they first look at the review. Maybe this is because of the e-commerce platform usage, right? We are habituated to buy something if we only see a positive review. So your 1 or 2 minutes of time will definitely kind of give our team a new confidence and boost to work even harder. Okay, if you open your website and log in, if you go to the course page of test series, you have a review column here. Just click on the review. When you click on the review, you can see the older reviews, and also when you scroll down, there is an option to leave a review. Just write the best part of our course, and also give a rating here, and give description like in detail what you feel about the course, what you want to tell us. Is there any thing that we need to do so that we can work on that also. Okay, but I am expecting positive reviews, because personally I believe that we have put in a lot of efforts this time to make this test series as useful to you as possible, right? And on top of that, as I said, fortune favors brave. Okay, sometimes what happens, we fall in a vicious cycle of not reading at all. Okay, first we think that we'll start revision, then what we'll do, because some subjects are lengthy, okay, bulky, our brain starts believing that it is not possible to finish. Okay, not possible to finish. Then what we'll do, because it is not possible, we'll leave the subject. Okay, then this will put anxiety. Okay, anxiety, in anxiety we don't read. Okay, now the anxious cycle will repeat. So the same cycle will repeat. See, you have only 24 hours in a day. If you sleep for even 7 to 8 hours, you hardly have 14 hours per day. Don't try to finish everything. Just start and make sure that you are gonna read as much as you can. When you do that, fortune favors brave. Okay, questions might come from the topic you have revised. Most of the test series questions are framed in a predictive fashion so that the strike rate is highest. I am publishing strike rate for last 3 years. We never came down to less than 70%. Almost 75% is strike rate of UPSC MEDICO. You will see a lot of new questions, but sometimes maybe there will be some bouncer kind of questions, tricky questions, clinical questions, but don't give away. If it is a tough question, it will be tough for everyone. Okay, so common things first, uncommon things next. So master common things, master PYQs, and do your best on the things which you already know. Okay, so that's the reason I have planned a revision cycle, because students are struggling to revise in last 5 to 6 days. If you haven't enrolled into the revision classes which we am going to conduct, do enroll into them, because I am going to do a fast paced revision from 4 days. Like, I'll leave you till Thursday evening. After that, you can just relax, give your language exam, and you're well ready to give your final exam on 29th. So all the best from team UPSC Medico. Don't forget to review our course. Okay, that will be a boost to my team to work even harder for the coming batches. All the best, and signing off.